LSD, or D-lysergic acid diethylamide, is a synthetic chemical which, when taken orally or less commonly in the lining of an eyelid or nostril, is the most potent hallucinogen known to the common public. One of the cheapest drugs available, it is neither addictive nor physically dangerous. LSD was synthesized for the first time in 1938 in Basel, Switzerland, by a chemist by the name of Albert Hofmann in his pursuit to find a blood stimulant. It was in 1942 when Hofmann accidentally consumed some LSD when its hallucinogenic effects were discovered. Later, it was found that an oral dose of as little as 25 micrograms, equal to a weight of a few grains of salt, is capable of creating vivid hallucinations. LSD is manufactured from lysergic acid, which is found in the ergot fungus that grows on rye and other grains. It is made in illegal laboratories and most commonly in the United States. It is made into crystals, which are then converted into liquid form for distribution. LSD is odorless, colorless, and has a slightly bitter taste. LSD is one of the cheapest drugs available, ranging in prices anywhere from $3 to $15, depending on the dealer and the quality of the drug, thus explaining its popularity among teens, young adults, and college-age students. On the street, LSD is called acid, blotter, bloomers, California sunshine, hippie, Looney Tunes, Zen, Lucy in the Sky with Diamonds, and more. LSD may be provided in liquid or pill form, but it is usually diffused into blotting paper and then is imprinted with cartoon characters. Each square is one dose of LSD. The blotting paper is placed under the tongue and sits there for roughly 10 minutes or until the paper is mostly dissolved. After about 30 to 60 minutes, the effects will occur and the user will start to notice a change in perception, such as subtle rainbows or rainbow halos, encircling lights, and geometric patterns when they close their eyes. Experiences on LSD can be described as a drug-induced psychosis, a disruption or a disorganization of a person's capability to recognize reality, think rationally, or communicate with others. Users refer to LSD and other hallucinogenic experiences as trips, and to acute adverse or unpleasant experiences as bad trips. On some trips, users experience sensations that are enjoyable and mentally stimulating and produce a sense of heightened understanding. Bad trips, however, include terrifying thoughts and nightmarish feelings of anxiety and despair that include fears of losing control, insanity, and death. Some of the most prominent effects of LSD will occur in the prefrontal cortex of the brain, the area responsible for controlling mood, cognition, and perception, as well as other regions important in regulating arousal and physiological response to stress and panic. While this may be going on inside the user's brain, immediate physical signs of LSD use include dilated pupils, high/low body temperatures, dry mouth, sweating or chills, and restlessness, anxiety, impaired cohesion, and loss of appetite. LSD does not leave a long-term physical mark, such as the scars and rotten teeth that meth induces in its users, but it does have other side effects. Depression, mania, and even schizophrenia can be triggered by the hallucinatory effects of LSD. Some users may also experience drug-induced psychosis after using LSD, which prolong the effects of the drug in an unwanted way, evoking more hallucinations, delusions, and bizarre behavior. Ultimately, LSD poses a threat to the brain's delicate chemistry, regardless of a person's mental health status. A person caught under the influence of LSD may be charged for public intoxication. Public intoxication laws vary widely from jurisdiction, but usually require some obvious display of intoxicated incompetence. However, the cost for possession and distribution of LSD is much more serious. Like most illicit drugs, LSD is typically not prosecuted in the federal criminal system. Because LSD is mostly manufactured domestically, there are considerable penalties for the trafficking of LSD. As with other illicit drugs, LSD carries penalties in most states, from the minor offense of mere possession to the major offenses such as distribution. Most states mirror the federal classification of LSD and have it listed as a Schedule I drug. The possession of LSD with the intent to sell results in 3 to 15 years of jail and a fine of $2,000 to $300,000. LSD is not classified as an addictive drug, so it carries with it a little risk of physical dependence and no documented evidence of withdrawal symptoms. LSD users can safely stop taking the drug without experiencing any physical symptoms of withdrawal. However, LSD is considered physiologically addictive. Overcoming the mental dependence on LSD may require counseling, therapy, and support, just like any other drug addiction. Recovery time depends on the user's personality, the quality of the treatment they are receiving, and the time in which the drug was abused. With the right care, time, and treatment, users addicted to LSD can quit the drug and therefore be cured.